So today I wanted to talk a little bit about the role of a physical therapist and the role of physical therapy in general. This is by no means a knock on physical therapists. We refer in and out to PTs all the time. I think they have a very good role and they're very helpful. The ones that communicate, and we've worked with athletes together, it's been awesome, and I think we have really helped the athlete together. But when someone gets injured, I think that the tendency for, at least in the high school setting, with a parent's understanding of what's going on with the different roles of a strength coach versus a physical therapist versus an athletic trainer, it gets a little confusing. And then they rely on the physical therapy to take care of everything, which is unfair to the physical therapist and is not going to be best suited for the athlete in the long run. So this is, again, not a knock on physical therapy. This is just a conversation I've had a few times recently with parents, and I want to try to clear the air with what's going on. So let's use a high school pitcher, for example. He gets injured. So we'll say that it's a high school pitcher. And he injures the elbow. So this is more of a muscular injury, probably more of a forearm, we'll say, for the sake of the argument. So that happens most of the time. Doctor runs the MRI. It's not a torn UCL, just some inflammation. Needs rehab, projected to do some rehab and a throwing program to return to play. So that pitcher is then referred to the physical therapist, which should happen. Now, the problem that we see is often that is all that they do, is they get injured, then go to physical therapy. They don't work out on their own. They don't do anything for the rest of their body. They go to the physical therapist. The physical therapist is working largely shoulder, forearm, bicep, tricep, whatever was going on there. Probably some mobility issues as well. And they're addressing the arm, which again is their job and what they're supposed to do. But we had elbow injury, and why did that happen? So that's always the first thing. And it could be with the elbow specifically, landing hip, internal rotation. So there's been a large correlation shown in many studies that if your internal rotation on your front leg is not good, the range of motion is not where it should be, it puts more stress on your elbow. So a lot of times, depending on who the physical therapist is, they might not address this. More of a big picture thing that I'm trying to get at is there are other weaknesses in the chain that are not going to be addressed if you just go to physical therapy and just work on the arm. You need to be doing something else. You need to be working out. You need to be doing hip, ankle mobility, strengthening the smaller muscles in those areas, along with probably just getting stronger. Your overall tissue throughout your whole body is not able to handle the capacity of the stress that you're putting on it. So again, just understanding that concept is that the tissue is less than the force. And if that's the case in anything, a sprained ankle, for example, when you land on your ankle, the tissue is not able to handle the force of your entire weight coming down the side of your foot, so it rolls. And then you have the result of the injury from the ligaments and tendons being stretched. So it could be landing hip IR, internal rotation, it could be throwing motion. So if these two things are not addressed, obviously when we go, he or she can do as much PT or rehab as they want, and when they return to play, they're more than likely going to get injured. When you go to rehab, their goal is to get the shoulder back to, or the arm, we'll say the arm, just to stay general here, back to 100% and probably a little bit stronger since it did get injured. But the rest of the body is not being worked on. So during this area of, from the time you get injured all the way to turn the play, the rest of your body has atrophied. So you're actually weaker than when you got injured. So what sense does it make to be weaker for the rest of your body, even though your arm might be stronger, so than at the time of injury? Again, if that goes back to the rest of the tissue in the body is not able to accept the force, and then you're looking at, even if the arm is a little bit stronger, is probably taking on more of a load, and you're not nearly as efficient as you were at the time of injury. So we go back, do the throwing program, do the rehab, go back to the return to play, go through your throwing program. Throwing programs are more to build up, not to address a throwing motion issue. So again, if you have a throwing motion issue, it doesn't really matter how good your strength conditioning is, how good your physical therapy is, any of those things. Like, you're going to put yourself at a large chance of injury, and that's a discussion for a different day. But if that throwing motion or issue is not addressed, then you don't have much of a chance. So if the rest of your body isn't addressed and your throwing motion isn't addressed, the return or the chance of re-injury is very high. So what we want to help people understand is that when you get injured, we want you to go to PT and physical therapy rehab. We really want that. That is a good thing to do. You also need to include strength and conditioning for the rest of your body. The way we look at it is they're going to handle more of the site of the area and give us feedback on what's going on. They can do some manipulations and some things that we're not legally allowed to do. But if you're not strengthening the rest of your body, you're going to end up back down here where you're atrophied, and then when you return to play, you are not going to be able to withhold injury. So again, the tissue being less than the force, we're returning to play, and the shoulder or the arm, we'll say arm equals 110% of when it got injured, but the rest of your body is going to be less than 100% from when you got injured. So if the rest of your body is less than 100% from the time you're injured, you already were not strong enough at that point, therefore the injury comes into play, and now you're even weaker from as far as the whole body is concerned. You're not setting yourself up for success. So no matter what the injury is or the sport, if you get injured, you should definitely see a physical therapist. You should definitely go through rehab with them, but you also need to find a strength conditioning specialist or someone that's able to take you and incorporate the rest of the body to make sure that you're moving well through those parts, that you're strong enough through those parts, that you're more powerful, and that, if it's something like a throwing motion, see a pitching coach that knows what they're talking about to help with the sequencing and the arm action, and that should give you the best chance to come back to play and return to be healthy when you return to play, and you should actually be better. And that's why people say, well, we came back from injury, he's actually throwing hard or something like that. Usually those are the athletes that take advantage of all these different circles and are able to combine them into one and come back and be better.